Welcome to The Spine Guy. I'm Dr. Brian Sue, a fellowship-trained spine surgeon. The Spine Guy is a channel dedicated to making the complex spine simple for patients to understand. Hopefully you've watched a video explaining what a cervical laminoplasty is, which is a treatment for spinal cord compression or cervical myelopathy. Today I'm going to take you into the OR to show you what a cervical laminoplasty looks like. Just as a reminder, the cervical laminoplasty involves a surgery from the back of the cervical spine, making a cut on one side all the way through the bone, making a cut on the other side partway through the bone, and trapdooring or hinging each of the segments open, and then placing hardware to stent it open. It is not a cervical fusion, it's a way of taking pressure off the spinal cord while maintaining cervical range of motion. I think it's a great operation. It's relatively minimally invasive. Not every patient's a candidate for it, so you'll have to talk to your surgeon to see if you're a candidate for it. Today I'll be showing you some footage into the operating room by Dr. John Heller, who has a great recording of what a laminoplasty looks like in the operating room. The technique that he's using is almost identical to the technique that I use. So just to orient you a little bit, the first cut is made, which is going to be the open side. The open side is going to be on the patient's right side, which is here, that you see on the video. But what's happening is a diamond tip burr or a non-end cutting burr is used to cut through the outer surface of the bone in towards the inner surface of the bone. And because it's a non-end cutting burr, it doesn't cut the spinal cord or the dura. And that drill is gently just taken all the way down along each lamina and gently cutting all the way through up until you can see the gray, which is the dura that's covering the spinal cord. You'll see water dripping used, and just like any burr, it does create little bone shavings, so the water is used to help that as well as any heat that's generated. This is a Kerrison punch that is used to smooth the end of the bone, and here you can see a little bit of the spinal cord covered by dura peeking out. Next, the hinge side is made, and that's going to be made on this patient's left side. So that's over here. And similar to the right side, a trough is made, but the burr does not go all the way through the bone. It goes through the outer cortex of the bone, and it stops at the inner cortex so that it's springy, but it's not completely broken. And here you'll see a technique where we put a curette to see if there's springiness on the hinge side of the door, which is on the left side, versus the open side, which is the right side. Now we'll take a little nerve hook and elevate each lamina separately, and you'll see the spinal cord and dura come into view on that right side. The forceps that are being used there, those are little tweezers that are called bipolar forceps. So what they do is they coagulate any epidural bleeders that are over the spinal cord and dura, and you'll see here gently lifting up at each separate level. And what that does is it hinges on the left side and opens the right side to create room. A lot of people ask me which side I create the hinge versus the open side on. Sometimes what will happen with these cases, patients will have myelopathy, which is compression of the spinal cord, and also what's called radiculopathy, which is compression of the nerve. If there's radiculopathy, we'll sometimes perform what's called a foraminotomy, which is a small opening to free up the nerve. So I'll usually pick the open side on the side that I'm doing the foraminotomies on because it's a little bit easier to do that. Next, you'll see a plate that goes on, and what this plate does is it has a little foot that sits on what's called the lateral mass bone, which is here, and another foot that sits on the lamina that's open. And these small screws that are placed after being drilled, these are little screws that almost look like the screws for eyeglasses. They're so small. But a few screws are placed in the lateral mass to hold the plate down to the lateral mass, and a few screws are placed on the lamina side to hold that open. And sometimes bone graft is placed where that opening is. Most of the time it's not, and that's because the hinge side actually heals open, and once that hinge side heals, there's enough space for the spinal cord. And here you'll see that a couple of plates have been placed to each level. So there's still independent motion between each level, but the hardware is secured. So hopefully you learned something about what a laminoplasty looks like in the operating room when it's performed, and it helps you understand the procedure a little bit better. Again, only your surgeon can tell you if you're a candidate for laminoplasty. Not everybody's a candidate for laminoplasty, although it is a great procedure. Don't forget to click the like button and leave questions in the comment box below.